The concussion awareness webinar, it's put together by the medical professionals, but it's very much targeted at lay people, so coaches, players, teachers, and parents. One of the reasons why a lot of the governing bodies are really pushing the area of concussion awareness is because of Benjamin Robinson. He was a young lad, a young 14-year-old who played rugby in Belfast. And unfortunately, he died from second impact syndrome after a school rugby match in January 2011. Okay, so he was involved in several heavy tackles before collapsing near the end of the game. The coroner at his inquest in Belfast said it was the first such death recorded in Northern Ireland. So what we would say is it's a rare occurrence, but it's one too many, and I suppose that's why the awareness and the education gets out there to as many, as I said, as many teachers, parents, and coaches as possible. What we're going to cover tonight, we're going to have a look at the brain, and again, we're not going to go into too much detail. Again, it's very much targeted at the lay person's level. We're going to look at what is concussion. We're going to have a look at the recognition of the signs and the symptoms, the potential dangers, the principles of management or the action plan for yourselves as coaches or parents, considerations for children. Quite often, concussion can present itself differently in children than in adults. There's some information on helping your players cope. We're going to have a look at, or going to familiarise you with the return to play protocols, and I'll refer you to some of the resources that are on the the learning.gaa.ie website. Okay. So the brain. I'm not going to spend too much time on this, but it's just to give you a bit of background. There's 4 lobes of the brain. The front, which is responsible for your personality judgment, so who you are. The sides, so the memory, the sensory, and the movement. And the back lobe is responsible for vision. So it would stand to sense if a player gets a bang to the side of the head, that's when their memory or their movement may be affected. If it's a bang to the back of the head, that's when they may get double vision. Okay, the other parts of the brain, the midbrain, that's responsible for the vital signs, and the cerebellum is responsible for your coordination. So again, you're not going to get quizzed on anything like this. It's just a little bit of background for yourselves. The brain, so how it's protected. It's protected from the outside in. Okay, you can see I'm going to scroll my mouse over here. This is the inside of the skull. If you compare it to the outside of the skull is quite smooth, whereas the inside it can be quite rigid. So it's not as smooth on the inside as what it is on the outside. And quite often what can happen is somebody gets a hard hit or a jolting motion during a game. Quite often what can happen is their brain can collide with the inside of the skull, and that can be enough to cause a concussion. So that's an interesting point or a learning tip from tonight. Somebody doesn't have to get the bang to the head in order for them to be concussed. Okay, they could take a very heavy hit to the chest, which results in like a jolting motion, and that can be enough for the brain to collide inside the skull and cause a concussion. Moving on, I suppose, to this little box here, just to give you an idea of the protection of the brain, and there's not a lot. Okay, so you've got the hair, then the skin, then the bone. Okay, you've got a little bit of fluid here, which equates to about 1/3 of a can of Coke, and then the brain. So you would say it's probably not the best design, or doesn't have that much protection. A small point that I would like to make, I'm sure that there's people, hurling people and camogie people on, just because somebody's wearing a helmet does not mean that they can't get a concussion. And it goes back to the very reason that I've said, they could still get a bang to the body, which results in a jolting motion and the brain colliding with the inside of the skull, and that can be enough to cause the concussion as well. So what is a concussion? All right, I'm just going to go through this very quickly. Concussion is a brain injury that can be caused by a direct or indirect hit to the player's head or body. Concussion typically results in an immediate onset of short-lived signs and symptoms. However, in some cases, The signs and symptoms of concussion may evolve over a number of minutes or hours. So in other words, what that's saying is some people, when they get a concussion, their signs and symptoms will come on straight away, whereas others, it could be hours before they start presenting with symptoms. So concussion, it's a brain injury, okay? The problem with the concussion is you can't actually see it. In a game, if somebody dislocates a finger or they cut their leg, or if they break their leg or something like that, you as a coach or a parent can see it, whereas it's kind of invisible because you can't actually see the injury, but it is what's known as a brain injury. It can result in a temporary loss of brain function. It's ultimately a clinical judgment for a medical doctor. So that's a key point for tonight. It's not up to you or anybody as a coach or a parent to diagnose a concussion. Okay, it's your job to recognize the signs, or the player may experience the symptoms, but if you suspect it, remove the player from the training session, from the game, or indeed if it's at break time, just like a recreational game, remove that player if you suspect that they may have a concussion, and then advise a parent or guardian to refer to the medical doctor. So that's important, just to reiterate that. It's not up to you to diagnose a concussion. That's for a medical doctor. It's up to you if you've recognized a collision happening within your environment or your training session or the game, and the player is showing symptoms, or you're noticing signs that they may be concussed, you've got to get them off the pitch and refer them to a medical doctor. Okay. Signs and symptoms. Okay, so what for you as a coach to watch out for? Most concussions occur without a loss of consciousness, so that's a big thing as well. Quite often people think, no, he or she's not concussed because they didn't lose consciousness. I think it's something like 90% of concussions occur without losing consciousness. Some symptoms develop immediately, whilst others appear gradually. So what's a symptom? So the symptom is something that the player will actually feel. The sign is something that a player's teammate or a coach or a parent will notice. So as was said earlier, if you suspect concussion in one or more visible cues, signs or symptoms, or errors in memory questions, you've got to get that player off the pitch. What will a player feel if they have a concussion? So they may feel a headache or pressure, they may feel nauseous, they may have balance or dizziness problems, double or blurry vision, sensitivity to light or noise, they may feel sluggish, hazy or groggy, they may have concentration or memory problems, confusion, or they might explain that they just don't feel right or they feel down. Or, as we said earlier, it may be an hour or two before they start presenting any symptoms, so they may feel nothing. Now, as a coach, a parent, or a teacher, these are the signs that you may notice that a player is concussed. Okay, so they may appear dazed or stunned. They could be confused about their position. They could forget an instruction or be unsure of the game details. They may move clumsily. They may answer the questions slowly. And again, maybe just a tip, I suppose, that I came across. Sometimes the old style way of diagnosing a concussion was holding up fingers and guessing how many fingers there was. Probably what's recommended now is that you ask a player a question that gets them thinking. So say, for example, who did we play last week, and can you remember what the score was? Something that's going to get them thinking, rather than holding up fingers, and they've probably got a 1 in 5 chance of getting that right. Okay. Another sign may be that they may lose consciousness even briefly. They may show mood, behavior, or personality changes, or they may forget events prior to or after the hit or the fall. So what are the dangers of concussion? So the risks of leaving that player on the pitch. So say, for example, it's a game that a player's taken a hit to the head. You suspect that the player may have a concussion. The risks of leaving that player on, very serious. It can be fatal. Concussion must be taken extremely seriously. With rest, most people fully recover from a concussion. Some people will recover within a few hours, others take a few weeks. When a player's brain is healing, it's more likely to sustain another concussion. Repeat concussions can increase the time it takes to recover, and in rare cases, repeat concussions in young players can result in brain swelling or permanent damage to their brain. So to sum this up, it's very, very important that young players are removed from that environment, from the game, from the training session, if they've got a concussion, and do not return until that concussion is fully resolved, or they're fully recovered from it. And as we mentioned in an earlier slide, second impact syndrome. So second impact syndrome, it's a second concussion before the first one has resolved. The stats are scary, okay? It results in death 50% of the time, results in permanent disability 100% of the time. Children are more susceptible due to their immature brains. There's a risk of permanent brain injury. There's a hugely increased risk of further concussions after suffering the first one, and cumulative concussions can cause permanent brain injury. So the phrase at the bottom here, the player has a lot more to lose than a match. I know the scenario, even at adult level or youth level, it's a championship final or whatever, and you might think to yourself, we'll leave him on or leave her on, and they're our best player, and they'll be okay. The advice that's given is do not even consider that. If you think that a player has a concussion, you've got to remove them from that environment. Okay, so what should I do if I suspect a player has concussion? Obviously, we spoke about it. Take the player off immediately. So an action plan for coaches, and again, hopefully nobody's scribbling down here frantically and trying to write down all the points that we've put up here. All this information is contained, I'll put it up at the end, it's learning.gaa.ie. Okay, so basically, to reiterate what we've just spoke about, as a coach or a parent, you must recognize the signs, you must remove the player, and you must reiterate the key messages. Don't try to hide it. Don't try to hide a concussion from anybody and think, we'll play them in the next game, they'll be okay. All right, report it to the parents, who will in turn get that player to the medical doctor. Allow time to recover, obviously seek medical advice, and then adhere to the return to play guidelines, which we're going to come to now in a minute. So the GAA guidelines, a player with a diagnosed concussion should never be allowed to return to play on the day of an injury. Return to play must follow a medically supervised stepwise approach, and a player must never return to play while symptomatic. The most important aspect of concussion management is physical and cognitive rest until the acute symptoms resolve, and then a graded program of exertion prior to medical clearance and return to play. Listen, there's a lot in that. Basically, to sum that up, there's a return to play guide, which we're going to come to now in a minute, and it's a simple step-by-step process that players can use before they return to play after they've recovered from the concussion. Recovery from concussion should not be rushed or pressure applied to players to resume playing until recovery is complete, and the risk of re-injury is high and may lead to recurrent concussion injuries, which can cause long-term damage. Okay, management in children and adolescents up to 18 years. Okay, concussion management is different due to the following factors. So brain development, variable growth rates, language difficulties. So sometimes a child may present to a doctor, their parents might have taken them to the doctor, and they don't actually have the language or the words to describe how they're feeling. And sometimes a child, a parent might try to speak for a child, and they may not be actually, I suppose, explaining the reality of how the child's feeling. There's also a lack of medical coverage at underage games, and physical examination in children is usually normal. So they may not present any symptoms even though they've got a concussion. So the general signs in children, what to look out for: crying more than usual, a headache that does not go away, changes in the way they play or act, changes in the way they eat or sleep, being upset easily or having more temper tantrums, a sad mood, lack of interest in their usual activities or favourite toys, loss of balance and trouble walking, not being able to pay attention, or as we said earlier, none or nothing that you can put your finger on. Okay, so the principles of management in children. So say, for example, a child has been diagnosed with a concussion by a medical doctor. they must rest, complete rest, for a minimum of 2 weeks before starting the gradual return to play protocol. So what's recommended is no sports, which fair enough is obvious, no TV or radio, no computers or Xbox. You know, good luck with that as a parent. I'm not sure if that's realistic, but I think that the message they're trying to get across is to limit those things as much as possible. No reading, no physical exercise, no exertion of any kind. Occasionally, there's a need for gradual return to schoolwork, so increase the breaks during the school day. So, for example, if your child has had a concussion, it may be a good idea to speak to the school to explain that, and to explain that maybe they might need a bit more time to complete tasks. And obviously, parents should always seek medical advice. The return to play, as we spoke about. In the initial rest period is 48 hours for an adult male, 2 weeks for a 15 to 18-year-old, and all females after a diagnosed concussion. So if a player has been symptom-free without medication for 48 hours or the 2 weeks, he or she can start the gradual return to play protocol. It's 6 stages. Each stage takes 24 hours. And the important thing is, if a player fails one of the stages or feels symptoms reoccurring, they have to drop back a stage before they can move on to the next one. A player should only return after successfully completing the protocol and obtaining medical clearance. And I'll speak a wee bit more about that later on, just to clear that up. Okay, so the return to play guideline. So say, for example, the players had the concussion. Okay, for an adult male, they must take 48 hours rest. For a male or a female, sorry, a male between 5 to 18 years of age, they must take 2 weeks, and all females must take 2 weeks before they do anything. Okay, so that's stage 1. Stage 2, what's recommended is low-level physical activity. So light jogging, stationary bike, or walking. Only when the player can do that without any symptoms can they move to the next stage. Okay, so that's non-contact physical activity. So say just a simple drill, a hand passing drill, or a kicking drill that requires no contact. If they complete that without symptoms, they can move to the next one. And that would be non-contact sport-specific practice. So an example of that would be maybe more, I suppose, complex drills or multi-directional or something that requires the player to think. Okay. Stage 5, then they can return to full contact practice, and stage 6 would be unrestricted return to activity or return to competition. Now, the key thing is they may only move a maximum of 1 stage per day, and it may take longer. So they may spend 2 or 3 days at stage 3 or stage 4. If symptoms occur, as I said earlier, drop back to the previous stage and try to progress after 24 hours rest. And a key thing is medical clearance is required before stage 5. So basically, the player gets the concussion, they must take whether it's a male, they must take the 48 hours rest or the 2 weeks, depending on their age or if they're a female. Then they can start stage 2, stage 3, stage 4. They must get the medical clearance from a doctor before they start stage 5. Helping your players cope. Okay, so what can we do? You can advise them to rest, both physically and mentally, and avoid alcohol. How can you support players? Players can tire when carrying out tasks that require concentration, so work and school. Be mindful of mood difficulties, feeling depressed, anxious, or irritable, and be patient with your players. It's better to have missed 1 game than a whole season. So that's a key message. Get it right at the time. Allow the players the right amount of time to fully recover, so that they might miss 1 or 2 games, but you'll get them back for the rest of the season. Educational resources. Okay, there's a lot of stuff. If you go to it's down here, it's the Learning and Development portal. Okay, so it's the learning.gaa.ie/player, or even if you put in /concussion there's a variety of resources there. There's resources for coaches, for players. The gradual return to play protocol, as we just spoke about, is contained there as well. There's actually an online course that you can do. It takes about 15 minutes. There's some videos there, and I think there's about 10 questions at the end that you can do and test your knowledge. And I would encourage, people who aren't on the webinar tonight, if you could encourage the coaches or the teachers within your school to complete that online course as well, to get as many people educated in this area as possible. Okay, so basically the key message is the same. All right, as a coach, as a parent, recognize the signs. Okay, remove that player. Don't be in doubt. Get them out of that immediate danger, and reiterate the key messages. Don't hide it. Report it. So report it to the parents. Maybe if it's happened at school, make sure that the club manager knows. If it happens at the club, make sure the school coach knows. Okay, take time to recover, seek medical advice, and adhere to the gradual return to play guidelines. And again, if in doubt, sit them out. Okay, thanks very much for your attendance at tonight's webinar, and I'd welcome any questions that you may have.
Good stuff, Ryan. Thank you. We have a couple of questions that come in.
Yeah.
First question is here: if, as a referee, you know a player has a concussion, but his medic and management are happy to let him play on, what is your opinion on this?
Yeah, that has come up before. I think, yeah, the referee, if the referee is pretty sure that the player has the concussion, he should be letting the coach and the management know. I think for the referee to make a call on it, I think he or she has enough going on with officiating the game. So I think if an example that I've heard is one of the referees, quite actually a high-profile referee, has spoken to a coach, and the coach refused to take the player off. The referee then said to him, "Listen, I'm making a note in my notebook now that I have told you that this player has got a concussion, okay, and you have chosen to ignore that." And after the referee did that, the coach thought better of it and removed the player. Okay, so it's not actually the referee. The referee doesn't really have the authority to make that call, but I thought maybe that was a good way of getting the message through to the coach and getting that player off the pitch.
Perfect, thank you. Another question here: after a concussion and the mandatory 3-week layoff, does the player need to seek medical clearance from their GP to resume training and playing?
Yes, no, it's not the 3 weeks. I think 3 weeks is probably maybe more from rugby. So again, if it's a male player, what they have to do is they have to take 2 days complete rest, and then start the gradual return to play. They do need that signed off by a doctor before they can join in to the actual contact end of the training. Okay, so again, if you go to the Croke Park or the GAA's learning.gaa.ie concussion, all that information's there, and it'll give you a step-by-step process as to how to manage the concussion. But the key message is they can't return to play or to full contact training unless that's been signed off by a doctor.
Perfect, thank you. So another wee question has come in here: why does it take a while for symptoms to show at times?
I'm not sure. I'm going to be honest about that. I suppose I'm trained up to deliver this course, but I'm not an expert in concussion, so I don't know the answer to that. What I can do, Oisin, if you can take details, I can find that out for whoever's asking that, but I'm not sure. But it, as I say, it can present straight away, or it can take a series of hours before the symptoms present.
Thank you. That was a tough one for sure. We have a couple more, just with 2 more, and then we'll wrap it up there. For adult or female players, is it a full 3 weeks recovery, 2 weeks non-activity, plus the 6 stages recovery with 24 hours between each stage?
Yeah. So For a female player, it's 2 weeks. Okay, if you've been diagnosed, if you've went to the doctor and you've been diagnosed with a concussion, that's 2 weeks completely off from anything, and then you start the return to play protocol. If you get through the first 4 stages without symptoms, so each stage does take 24 hours. So if you get through those, that's another 4 days. Then before you go to stage 5 or stage 6, you need signed off by the doctor to say that you've recovered fully from your concussion, and you can, once you've got that, you can return to full contact training and then full contact games.
Perfect, thank you. Okay, so our final question: should players who play other sports, for example soccer and rugby, be screened, and should these, when returning to the GAA, and should coaches in GAA ask players if they've received bangs in the heads in other sports?
Yeah, no, listen, that's a really, really good question. We had an example, even within our own sport, a player received a concussion playing for their club and went to play for the school the next day and fainted during the game. And listen, they didn't tell the teacher, or they didn't tell the coach of the school team, and that teacher was left in a bad position because they didn't know what was wrong. So that is I suppose the reality. If we play multiple sports, so a kid playing rugby or soccer could have received a concussion at that, and then they're coming to play GAA or hurling, football, whatever it is, and they need to report that. They need to report that to their coaches. So again, it's a very, very good question, but I suppose the emphasis, that's why we're trying to get the education out there. The emphasis is on the parents and on the player themselves to report that to their coaches, so that the coaches can deal with it and allow them to the rest that they need and the recovery time that they need.
Perfect, thank you, Ryan. Well, there's just one last wee question that's come in here, and this will be our last one. I'll not keep you any longer. It seems to be a good conversation here, good conversation starter. So, a clash of heads between children can be seen as no problem, but how do you inform child, the coach, or the parent that is a potential concussion problem?
Yeah, well, that's if the child is presenting the symptom or the signs that we just went through, if they're presenting any of those signs, and you've seen that the impact has been quite severe, and they're presenting those signs, that's an indicator that the child may be concussed, and that you need to speak to that parent. I don't know what environment, if say it happens in school, if you're a teacher, you've got to report that to the parent, or if it happens at the club during one of your training sessions when the child's being picked up, you've got to report that and advise them that they need to go and be seen by a doctor. So again, Archie, just I suppose the key message is it's not up to any of us to diagnose a concussion, but it's up to us as coaches, as parents, as teachers. If we feel that somebody in our care has received a bang and they're presenting symptoms or showing signs that they may be concussed, you've got to inform the parents and recommend that child sees a doctor.
Brilliant, thank you, Ryan.
Okay.
So that'll do us for now, folks. Thanks very much for tuning in.